Welcome to another MedYouCate Originals video, Thoracoscopic Esophagectomy. Here is the view of the right thoracic cavity. We're going to perform minimally invasive thoracoscopic esophagectomy. So first we have to place our trocars. This is the thoracoscopic view of trocar placement. For this surgery, the patient is lying on the left side. We see that the right lung is collapsed. That is due to single lung ventilation being used during this procedure. This is achieved with double lumen ventilation, which enables the collapse of one lung and ventilation of the other. The surgeon begins the dissection with harmonic ACE device. This is ultrasound device from the brand Ethicon. The right lower lobe is going to be mobilized. As the dissection continues, we are approaching the hilus and we also see the pulsating heart. The right lower lobe has to be mobilized in order to be able to perform esophagectomy. For better orientation, here we have a schematic picture of the important structures.